We are with Assemblyman Herb Conaway, Chairman of the Assembly Health Committee. Dr. Conaway, tomorrow is a big day in health care throughout the nation. Is New Jersey ready for the Affordable Care Act?
Well, New Jersey could be more ready, certainly, but the federal government is, as you know, going to be in charge of running the exchange here in New Jersey, and one of the questions that is raised by the looming government shutdown is whether or not that enrollment process can take place as anticipated. It is unclear, quite frankly, whether or not folks will be able to enroll or start enrollment tomorrow as we thought. Will this be a big setback for the Obamacare? I don't think so. One hopes that the Congress, that the administration in Washington will be able to come to some terms which will allow the government to continue its essential operations, or all of its operations, not only the very essential ones. And so that we're only going to be talking about a couple of days delay, and so its long-term impact, I think, will not really be seen. But there is a concern because so much of the when you've got an engine ready to start, when you have a race that's ready to go, when you have a trip that upon which you're ready to embark, it is a problem when all of a sudden that date is delayed. Some of the anticipation, some of the momentum may wane somewhat. But look, I'm very confident that at some point, cooler, wiser heads in Washington, D.C. will win the day, and we'll have a federal government that operates, and we'll get people enrolled and the insurance that many so desperately need, and we will see the very important changes that we're already seeing in terms of decreased costs for insurance and increased health status for those who now have insurance and are able to go see a doctor.
Once the impasse is corrected and people do start signing up for the Affordable Care Act, what will they see right away in terms of changes if they're currently uninsured?
Well, remember, there's a sign-up period that starts October 1st, but the actual insurance won't take hold until the 1st of next year. And so in the near term, there are going to have anticipation and at least some peace of mind to know that there is an insurance plan that will be ready for them come January 1st. So for the individual, no immediate change. I think for those of us who are monitoring this process, and we have a commission to do so here in New Jersey, that we'll look at the enrollment process. How easy will it be for people to actually enroll through the exchange? Are there issues with that process? Are there things that New Jersey can do to help ease that process? Are we seeing that there are gaps where we know there's need and yet people aren't being enrolled, and what do we need to do to respond to that? So these are the things that we're going to be monitoring in the near term, and certainly throughout the process as the insurance program stands up in 2014.
Based on the testimony you heard today from the medical organizations, do you anticipate any new legislation come the next session?
Well, I don't think that, look, a lot of these initiatives are things that are being driven in the private sector. There are, and what we understand today is sort of the critical importance of this integrated care model. And indeed, National Health Reform, Obamacare, envisions and it actually has provisions to ensure that there is collaboration between the physician on the one hand and the nurse practitioner and the PA on the other hand, and that the payment systems are predicated on this team approach between the physician leading the healthcare team and nurse practitioners and physician assistants supplementing and playing a role within that team. And so what we heard today was that when that team approach is taken, we actually, it's been proven that integrated team approach actually is the thing that helps bring down costs and improve outcomes over time. And so one of the questions the legislature may be asked in the future is, should we embark in a legislative course which would obviate the work that these teams are trying to do? Should we have a nurse practitioner ahead of this team? What will that mean for the outcomes that we're trying to achieve? I think what we've heard here today is that we have a model that has been studied and has been shown to work to improve outcomes, and that is and that if we take any action at all in the legislature, it should be to enhance that model, not to detract from it.
One of the linchpins of this integrated approach are the electronic medical records, but wouldn't electronic medical records lock a patient into a particular health provider if there's no interoperability among the various providers in the state?
This has been my concern from the very beginning. One of the reasons I put together a Health Information Technology Commission to look at this very question. I am a big believer that the power of the marketplace should be brought to healthcare where appropriate, and that is that a patient, if they're at hospital A or at hospital B or at medical group C, if they find that they are not being served in the way that they wish, let's remove the barrier that will allow that person to travel and get care elsewhere. One of the burdens to that change is what do I do with my records? How do I establish this relationship with a physician? What are the hurdles of that? Records are at the heart of that. And so having records available to you when you need it, at whatever setting you happen to present yourself here in New Jersey, is, I think, the key, not only to good health care, but also the key to driving improvements in healthcare delivery across the system.
Dr. Conaway, thank you very much.